Diabetes Connections is brought to you by DEXCOM. Take control of your diabetes and live life to the fullest with DEXCOM, and by Club 1921, where diabetes connections are made.
This is Diabetes Connections with Stacey Sims.
This week, it's called Sigi Pump, and last fall it received Breakthrough Device Designation from the US FDA. There's still a long way to go before this tubeless, rechargeable pump could be on the market, and company leaders say that's okay by them.
We're biding our time to make it sure it's excellent in every respect. Technically, from a usability point of view, of course, which is a huge focus to us, lowering therapy burden, and also just being able to produce it in sufficient quantities.
Pim Von Wesel is Co-CEO of AMF Medical, the company that makes the Sigi Pump. We'll talk about what makes this system unique, which partners they're eyeing for collaboration, and what the timeline for submitting to the FDA really looks like. This podcast is not intended as medical advice. If you have those kinds of questions, please contact your healthcare provider. Welcome to another week of the show. Always so glad to have you here. You know we aim to educate and inspire about diabetes with a focus on people who use insulin. Before we jump in, I want to give a big shout out to the amazing people in our Facebook group. If you're not there, it's Diabetes Connections, the group. And I just want to single them out because I think that it is the smartest diabetes Facebook group that's out there. I know I'm a little biased, but it's not the kind of group that's going to tell you how to eat or how to dose or you must do this or how dare you do that. As you know, if you listen to the show, that's not our deal at all. And I just want to take a moment because I've been asking the folks in there, many of whom have lived with diabetes for 50, 60 years, many of whom work for technology companies, many of whom have been blogging about diabetes for many, many years. And I've been bringing them questions that have come up in my local group, things like cannula length making a difference. Some questions I had about summer camps for this year. And they all also have fabulous conversations. So I know we're all, if you're on Facebook, you're in a ton of groups already. I do think that it's a really good one if you'd like to hear from people who have lived with this condition for a long time, who are very knowledgeable and frankly very opinionated, which I like a lot. I do run a very tight ship. I do this in my local group as well as this one. You're not going to get away with any nonsense, any weird stuff, any snake oil. We will have none of that. But it's a great group, and I just want to give them a shout out because they've been very, very helpful, especially lately. Okay, Sigi Pump caught my attention when it received that breakthrough designation that I mentioned. And to be clear, that means the FDA will try to speed it through the process. It does not mean it's approved or that it's guaranteed approval. And Sigi, by the way, is S-I-G-I. I did share some photos of it in the Facebook group. And my guest is Pim Von Wesel, the co-CEO of AMF Medical. That is the Swiss company behind Sigi Pump. They are very early on here. Clinical trials have not yet started, but they do plan that when they get through the process to launch in the US first. While it looks a bit like an Omnipod, but the pod part is reusable. You recharge it as needed, and they give you two, so you don't have to stop pumping while you're recharging one of them. The only disposable part is the infusion set, although they call it something else, the part that connects to the body. Lots more information about Sigi in my interview with Pim Von Wesel. Pim, thanks for joining me. I am excited to find out more about this product and this company. Thanks for coming on the show.
Thanks for having me, Stacey. Very excited to share what we have.
Yeah, I have so many questions for you, but let me just start by asking, just tell me a little bit about the company that makes Sigi. What is AMF Medical? What do you all do?
Well, AMF Medical was really spun out as a standalone company in 2021. But the history of the company goes back to 2014, when the founders hit upon a technology which they initially started using in some high-end components for laboratory equipment. But a number of the founders had a history from a previous startup in insulin delivery. It didn't work so well then, but when they analyzed this particular technology, they said, wait a minute, we can probably make a insulin pump with this technology that would work, that would not destroy insulin, it being a large fragile hormone. And they started a project in 2015. Over time, the project got big enough that they decided, I joined since then, to make it a separate company just because the investment story is very different for insulin technology versus, high-end lab components. So company started in 2014, spun off separately in 2021. Around the time we kind of came out of stealth. And, I joined a little over a year ago, basically to help build the business. After the founders started with the technology, hired a great R&D leader, Pierre, who turned it into a product, and then me to help make it a business.
All right, you mentioned coming out of stealth mode. The first time I heard about this was when the US FDA gave what they call Breakthrough Device Designation. Mm-hmm. What does that mean, and why is that important?
Well, it's important to us because we feel we have a few capabilities, particularly around usability and lowering the therapy burden that we wanted to test with the FDA if it deserved some recognition. Practically, it means that it puts it a little bit earlier and faster into the approval process. But we have an ongoing conversation with the FDA that started with a pre-sub submission conversation there. And we decided that we would try for this designation to get some recognition for some of the capabilities that we have. They picked up on a number of them, which got everybody very excited. In a way, it's recognition that we're addressing unmet patients' needs.
Okay, so I got a little bit ahead of myself there by starting by asking about the FDA. Let's just back up and talk about what the product is. Tell me about the Sigi Pump. What makes this different?
It is a patch pump. We have designed it for interoperability with multiple systems, so multiple third-party glucose monitors and multiple algorithms. And I think one of the novelties that we'd like to bring is just a tremendous ease of use. So we use standard pre-filled insulin cartridges. I think that's in a nutshell the product. It is a semi-reusable product. The pump itself is reusable. You would have two as a user with a dedicated charger. And whenever you need to switch it out because your cartridge is empty, you take your second pump up in the cartridge, use a new sterile cap to close it, and then put it back onto your pad. The pad is or tray, but we call it a pad, is basically placed on your skin, and you can clip your pump on and off as needed.
I'm going to describe this probably pretty poorly, but in my mind's eye, using existing technology, this seems to me like you use sort of a pump infusion set. So you would insert the tray, the base, as you called it, onto the skin. And then that's temporary, right? You would take that off every couple of days like you do right now. But the patch pump is more like a more durable pump, like a Medtronic or a Tandem, but you physically clip it flat. It connects to that infusion, what I'm calling an infusion set. And is that close to accurate?
I think that is a very good description, with the one caveat that we have the ambition for the pad to last a little bit longer than a couple of days, which basically means that once the pad is on the skin, let's just say for a moment that it lasts a week. As you run out of insulin, you take your pump off, you put in a new cartridge, and you clip your pump back on as long as the pad lasts. Or what you could imagine, somebody who has a very high need of insulin, they might, for instance, let's think people that are on type 2, not that that's our primary focus, but if they were to go through 160 units in less than 2 days, they wouldn't have to change the insertion of the pad or the disposable, if you will. So that's the idea. Absolutely.
Got it. We're going to talk about more features and, a lot more about what this system is about. But before we go any further, is what we're talking about in existence yet? In other words, is somebody wearing this? Is this in clinical trials? Where are you in the process?
So we have functioning prototypes. We have not, and we've tested the usability of those. We published something at ATTD last year, and we'll have some more information at ATTD coming up in March. So the product exists, but formally speaking, we have not done a first in human yet, and that's planned for later this year, towards the end of 2022.
Got it. Well, the next question I know my listeners are going to have is, can they take part in that? Are those first people in Europe or in the United States?
I'll be very honest, they'll be in Europe, and it is primarily just to, we're a startup, so we're trying to keep it manageable, and the coordination effort to do this in the US is probably a little bit beyond what we can do at the moment. But clearly, just to answer the follow-on question, our intent is to first go in the market in the United States, and that's why we have these conversations with the FDA.
Got it. Well, we have lots of listeners in Europe too, so we'll put all the information out as you're able to send to us. All right, so let's talk a little bit more about the product itself. or the system itself, I should say. The pump, you mentioned, refilling insulin. This is pre-filled pump cartridges as designed, right? This is not, you don't have to draw it out and fill it.
Correct. There's no, forgive the term here, fiddling to fill it. You basically take it out of the, insulin kept in the refrigerator and you pop it in straight away. You don't have to wait 20 minutes for it to warm up. The system is compensating for that, so there's no air bubbles. And these cartridges, they already exist. They're already on the market. They're just being used today with, the tethered pumps or the pumps you wear in a belt or in a pocket. So you mentioned the Medtronic pumps. Actually, there's other products out there that use this existing cartridge. And I think you've spoken about some of these pumps in other podcasts.
Yeah, it's interesting. We're so U.S. centric sometimes that I certainly tend to forget. I believe, Ipsomed?
Correct. Ipsomed uses that cartridge here in Europe. It's a pump cart, and they have their agreement with Lilly in the United States. And there's a Roche product as well that uses this. But to our knowledge, this is the only patch pump that's designed around this cartridge. And it's actually a big part of why the pump has the size that it has. We couldn't make it much smaller and still fit the cartridge in.
Tell me a little bit more about the pump design itself. As I'm reading through, it looks like it is controlled from a phone or controlled by a separate controller. Are there any buttons on the pump itself?
There are no buttons on the pump itself, and it is operated via your own smartphone. That's definitely the idea that we're working towards. We don't think people need another personal device manager in their pocket. Yeah. So we keep it simple.
And I've talked about system a few times. Let's talk about that. So Bluetooth enabled to go to a smartphone, to go to an eye controller. Talk about that a little bit.
It is in technical parlance. It's designed, and the discussions with FDA are as alternate controller enabled pump, so an ACE pump, and it has everything that you could design to. So we're not trying to backwards integrate an algorithm and interoperability with third party CGM. Is designed to be able to do that. And when we say designed to be able to do that, it has the communication capabilities with Bluetooth. It has the processing power to have an algorithm on board, and it has the battery life to deal with it as well. It's a rechargeable battery, of course. All of that is designed to be able to communicate and to calculate, work with dosing algorithms, if you will, that would be on board. There's some systems that have the dosing algorithm on a personal device manager or in the future on the phone. We can accommodate that as well. We think that there's some advantages to having the algorithm actually embedded on the pump, and we've designed it to be able to do that.
I may have missed this point. Mm-hmm. You're not creating an algorithm for the pump?
No, I think when initially, I think the ambitions were for the company were quite large. But if we really look at the core competencies, the core capabilities that this team has is around fluidics management and is around miniaturization. So over time, we also realized that, we should better stick to what we do well, and is just make an excellent pump, a truly excellent pump. Otherwise, we don't think we have any right to be on the market. And we have this open idea of, collaborating with, as far as we're concerned, with any algorithm that's approved, with any CGM that is available. So we really have an open protocol or an open system mindset there. And I think that's a little bit, if we read the documentation, what the FDA is doing with the creation of these new product categories, such as ACE pump and ICGM and eye controller, or if we read a little bit what the JDRF has as a position statement around the artificial pancreas, we're fully subscribed to that philosophy. So we're open.
Yeah, it's really interesting because ideally, and we've been talking about this for a couple of years now, ideally, right, you'd get your pump, you get your CGM, you'd be able to pick and choose and then say, okay, I want this algorithm. I want my, I'll put a blue sky thing. I want a Sigi, I want my Libre, and I want to use the Control IQ.
Correct.
Is that something you think is a real possibility here? Right back to Pim in just a moment. But first, Diabetes Connections is brought to you by DEXCOM. And we've been using the DEXCOM system since Benny was 9 years old. We started with them back in December of 2013. The system just keeps getting better. The DEXCOM G6 is FDA permitted for no finger sticks for calibration and diabetes treatment decisions. You can share with up to 10 people from your smart device. The G6 has 10-day sensor wear, and the applicator is so easy. I have not done one insertion since we got it. Benny does them all himself. He's a busy kid. And knowing he can just take a quick glance at his blood glucose numbers to make better treatment decisions is reassuring. Of course, we still love the alerts and alarms and that we can set them how we want. If your glucose alerts and readings from the G6 do not match symptoms or expectations, use a blood glucose meter to make diabetes treatment decisions. To learn more, go to diabetes-connections.com and click on the DEXCOM logo. Now back to Pim talking about interoperability and whether the system will work with other algorithms and devices.
Well, we're definitely building our product for that to work. It depends a lot, of course, on the collaboration that you can, put in place with some of these companies. And being a startup, a number of these collaborations are actually, very enthusiastic, and other ones are a little bit more in wait and see because we're still startup at this point in time. And I understand some of the bigger CGM companies, they might say like, well, let's wait and see if these guys actually going to make it to market before we spend an awful lot of time co-developing with them. But a number are very receptive and we have good conversations. So will it work with all? It depends. I don't think it's so much a technical question as a question of, is there the will to make it happen? But we're very encouraged by some of the collaborations that have been put in place. Still early days, but we plan to do our first human and fairly soon thereafter have what we call a hybrid loop trial with a select number of patients.
Not to belabor the point here, it would be too early to ask you which CGMs you would work with because you're still
let me turn the question around. Which CGM would you first like to see on our pump? Would
I first like to see? Good question. Here in the US, right, we only have DEXCOM and Libre and Medtronic's. I left them out of that because they're so proprietary. They only work within their system. So, if you ask me, I'm going to say DEXCOM because that's what we use. But I would also say, I'll speak out of both sides of my mouth. Everybody.
So
and there's 35 CGMs in the works, probably 2 of which will come to market.
Well, it's interesting that you mentioned it, Stacey, because the other day we basically had an inventory of the number of CGM projects out there. And I think it was getting to about close to 40 if you kind of all add them up. And we don't have 40 agreements in place. We have some of the agreements in place. And when I can talk about it, because there's confidentiality there, but you probably won't be disappointed with some of the names that we're talking about. But to your earlier point, there's different form factors, right? Some people are very comfortable with having, every 6 months or every 12 months, a minor intervention, not to have a wearable. Other people are actually, preferring a wearable. And I think we want to accommodate that, as you said, different form factors, different dosing algorithms. So that's our philosophy, and we're sticking to that for now and see how much of that we can make happen. But clearly, when we make our selection the same way these big companies do it, right? They say, I'm going to work with this startup. Well, how much do I believe they're actually going to exist 5 years from now? Those same considerations apply to us as well. Yes, we have some conversation with early startups, but if you want to be successful, we'll probably have to partner with 1 or 2 of the bigger ones first, just being very pragmatic. And that's what we're doing.
And I left out one, apologies to Eversense, the folks at Senseonics, who I'm sure you're very well familiar with, but I did not mention them as a US CGM company or available here, and they certainly are. I'm always going to say work with everybody. It's so interesting to think about how it's changed in the last, even the last 5 years.
Very fast now, right? But despite that, it's going so fast. We think there's really just only one really successful patch pump on the market. And we think we have something to offer in that space. We're at it, and we're focused on that.
Is it waterproof?
Yep.
Well, asked and answered. That's easy.
No, I think the way we think about patch pumps and and I've worked at some of the larger companies that have projects or had projects or have projects in the works on it. There have been so many attempts, I think, and there have been so many bridges burned in that space that we get a lot of pressure from investors and from, people that pick up on us on the website to go fast. And our philosophy, unless our product is excellent, we don't have the right to be on the market. And we're biding our time to make it sure it's excellent in every respect. Technically, from a usability point of view, of course, which is a huge focus to us, lowering therapy burden. And also just being able to produce it in sufficient quantities.
Sure.
High hurdle. We don't want to come out unless we're absolutely excellent. And I'll tell you the story, what I discussed with our R&D people. I said, look, we'll go to market when we are confident that we can pick a handful of influencers in the diabetes technology world, and we'll give them a product for 3 months, and we say, do what you want, write whatever you want. If we're totally comfortable doing that, then we're ready to go to market.
I had a question from a couple of listeners. You've answered this a little bit about the differences between Sigi and the Omnipod, which is, pretty much the closest to something like that we already have right here. And you've mentioned things that it's, it's smaller, it's lighter, it is rechargeable, so you're not throwing the pump itself away. Are there other differences you'd like to point out?
Well, I think the other one you pointed out as well, and that we put a lot of effort in, is the fact that it uses a pre-filled cartridge. Then this is designed upfront for interoperability, and we'll think will be very open. But I think you hit on most of them. Plus, of course, the fact that we use this pre-filled cartridge, which we think is also looking at the feedback that we're getting on our website. There's an encouraging number of Omnipod users who've picked up on our website and are sending us comments. So we'll keep working at it from that perspective.
I'm curious. I've been talking a lot in the last couple of weeks on the show about infusion sets. We had the folks from Convatec on talking about the different types that they're looking to make. You already mentioned hopefully longer wear. Can you talk a little bit about that part of this system? I know you can't, there's a lot of proprietary and I'm sure information you can't share, but just in terms of, seems to be that it would be a different type of insertion, just because to me, and I could be wrong, it seems like it might have to be bigger. I'll let you talk about it.
Let's talk about the insertion. The insertion is designed to be very fast, and fast in this respect often means, limited pain, right? If you do it very quickly. That's number one. Our insertion is intended to be very quiet, particularly with very young patients in mind. This should not be a scary experience. So that's the insertion. The cannula itself, we have a number of ideas around it to make it for 7-day wear. And of course, because the pump, this is not just the set itself, but the pump itself is very, very light. We aim to make it, very wearable from that perspective as well. We are doing a number of tests around you. We've done some testing around the wearability, and we've made some changes to the adhesive, and that's, continues to be a big focus. We're just trying to work with the best adhesive companies out there. And in terms of the cannula, we are doing some tests around making sure that we don't have clogging, and that we actually can get to 7 days without with too much inconvenience. We're putting for ourselves a pretty high hurdle there for 7-day use, and we need to see if we can get there. That's still early work. Yeah. But the one other thing I will say compared to some other pumps is we have no tubing at all, right? So the fluid path, if you will, from the cartridge to the skin of the user is actually very, very short. And that, of course, has the advantage as well, which other patch pumps have as well. Not all of them, but some for sure, is that there's very little insulin wastage involved. Of course, we really aim to completely empty the cartridge.
Are you making the infusion set or the connector? Are you all making that yourselves?
Yeah, we make everything ourselves except the insulin cartridges, of course, which are available, but we are doing everything ourselves. We have, from our microfluidics technology background, we have a lot of information on what works, and we've done extensive insulin compatibility testing with insulins that we believe will be available in these cartridges. So we have that data, which is very encouraging that, it lasts and it doesn't create any, material interaction issues, for instance.
You mentioned at the beginning of our chat here that you are relatively new to the company. And you also talked about you're already getting input, I'm sure, criticism, comments from the diabetes community from the website. What were you doing before this? And what has it been like to move into the diabetes space where people are very, very passionate?
Absolutely. I've been with the company formally for about a year. I've, been helping the management team, the executive team, and the board a little bit before that. But I have a longer experience in diabetes. I worked for about 5 years in diabetes with Medtronic in Europe. So this is not my first rodeo. It is a very engaged community and very passionate and very vocal. I've also worked in incontinence, and I can tell you that the people who have incontinence problems are a lot less vocal than people living with diabetes, for sure. And people stay around, right? It's been very encouraging to reconnect with some of the experts, the clinical experts I had the privilege of working with in the past, and they're still around and they're still advising and they're still happy to have a discussion and give very solid input. So quite a bit of experience with diabetes, been in medical technology for since 2003, if you will. So coming up to almost 20 years. But I must say that working in diabetes is in the diabetes technology field is particularly gratifying. You're actually much closer to what's happening than in many other areas of medical technology. So it's been good. Yeah. It's been good to be back. Absolutely.
That's great. Yeah. And in the past few years as well, there's been this push from the pump is, this clunky medical device to realizing that people, it's such a part of the day-to-day life of someone with diabetes. Our phones look great. Why can't our pumps look great? And I'm assuming that is part of the design here too. This is kind of silly to ask, but I did get this question, and I like silly. Is there any planning here to make it different colors, to have any designs on it, things like that?
A couple of things. Colors is not a high priority. We have a project extension matrix, and colors is actually on there. We think it's a fairly low effort. We are just questioning in terms of user benefit if there's not other things we need to focus on first.
Right, and also getting it to market probably is the top priority.
For sure. But, when you talk to people in the diabetes investment community, they want to see some ideas of what else you can think about for the future. And we have a number of ideas in this. But particularly for young users and pediatric patients, for instance, we know these things are important. In my former life, I've spent a lot of time coming up with cool stickers that worked on a pump, if you will. But we already worked very hard on the design. If I show you one day the first prototypes, they looked very different and quite a bit bigger. And we're very fortunate to work with an excellent design company around some of these four factors things. I didn't fully appreciate that necessarily when I started, but for instance, the applicator has gone through numerous iterations to allow for single hand application at all different body parts so that the angle still works. And one of our investors, said, "Oh, I get it." I'm not sure if this analogy resonates in the United States. I think it does. But one of the investors said, "Wait a minute, you're like the Nespresso of insulin therapy." And I don't know if you made this espresso in the old fashioned way, you had to get the amount of coffee right. You had to get the pressure right. You had to get the temperature right. It's quite involved, right? And Nespresso comes around and kind of makes that, standard and repeatable and very, very easy to use. And then to take that a little bit further, it so happens that the design company that we've worked with around the form factor, not the technology around the form factor, actually happens to be the same company that designs the Nespresso machines. And they liked our project very much. And I wouldn't say they're doing it for free, but I think we're getting a better rate than Nespresso does.
A friend of mine makes a T-shirt that says, "I run on coffee and insulin." We'll have to send them one of those.
Absolutely. And I'll share it with my Nespresso friends as well.
Hey, I meant to ask you earlier, and this was a question I got from a listener. You have mentioned, we've talked several times about the pre-filled insulin cartridges. Do you anticipate a certain type of insulin? Will it work with most of the types that are out right now?
We have tested it for insulin compatibility with 4 insulins today. We've tested it with NovaRapid, we've tested with Fiasp, we've tested with Lumiev, and we've tested with Humalog. And we think that with that, we cover a very significant portion of the US market because there are some, there is a self-fill option as well for this product, although that's probably not the benefit that we're going to put forward that much. But we are very interested in working with multiple insulins, particularly if they could be available in pre-filled insulin cartridges. And we have some ideas as well, particularly for type 2, to work with higher concentrated insulins. And we have some discussions around, could the pump identify which type of insulin you're actually putting in your pump? You don't want to confuse U200 or higher with U100, of course. The further discussion around that, and this may be a little bit too far ahead, and is, wait a minute, you have different types of insulins. Are future algorithms going to take different types of insulin, rapid, ultra rapid, and to take that into account in their calculations? and how could we accommodate it. There's some of the discussions we're having with insulin manufacturers around, okay, would your pump be able to tell which insulin type you have actually just loaded your pump with? Does it make sense?
Interesting. Yeah, it's very interesting to think about that. My goodness. I was just thinking, like, could you use Humalog, Novolog, the four you mentioned? I guess Apidra would be the only one I would have a question about, but it just doesn't sound like you've tested it yet.
No, we've not tested it yet. And there's no other reason than that we know that the insulins I just mentioned, they would be available in the cartridge form factor. NovoRapid and Fiasp, that's public information that they're available in pump card. And we've all learned about the Lilly project with Ipsomed, and we kind of figured that they will use a similar cartridge. We don't think that it's going to be very different form factor wise. So that's why we focused on those four.
We've already started looking probably further ahead than we should with something like this, but you mentioned the next time there may be more information will be in March, and then more trials on people starting later this year. Do I have that correct? Anything else that you want to add that's happening in the near future?
I think we'll hopefully, one feature that we haven't discussed and which we are exploring very actively, and we announced this at the last ATTD, is that we have very fast occlusion detection. And we have now independent data, which we'll hopefully see published at ATTD, about comparative data, how fast our occlusion detection is. And we're exploring what are some of the benefits of that. Of course, we're trying to balance that against alarm fatigue, of course. We don't want everything to become, an alarm and basically drive people crazy. But we think there's some real benefits to having very fast occlusion detection, particularly if you go to very young patients. And I think we're seeing more and more people with diabetes getting diagnosed earlier and earlier. And here in Europe, at least, they almost instantaneously go on a pump. And we think we want to accommodate that. So that's going to be some clinical work we need to do. How do we position the ability to, very, very quickly, we're talking minutes, not hours, right? If you have a very low basal rate, you might, not see an alarm in days. And we're actually minutes in that respect. And that's, of course, very encouraging that we still need to think about. So maybe that's the one feature we haven't talked about, and we're going to do some clinical work around.
Interesting. Well, thank you so much for joining me. I look forward to learning more. I appreciate you starting the conversation. Tell your folks when they send those pumps for people to try, send the espresso machine. We all love espresso. They could handle that.
Very good. I like the idea. Well, I want to thank you, Stacey, for the opportunity, and we're always available to answer questions.
Fabulous. We'll talk soon. Thank you so much, Pim.
You're listening to Diabetes Connections with Stacey Sims.
Lots more information about Sigi at diabetes-connections.com. Every episode has its own homepage with a transcription and more information. If you go there and the transcription isn't there, and it's an episode after January of 2020, it's coming. It just may take a couple of days to get it posted, but I promise it's there, and we are working our way backwards through the other episodes since we started the show in June of 2015. I did want to add one thing. I forgot to ask during the interview, and I asked it later. Why the heck is it named Sigi? I emailed them after the interview, and they told me that they came up with the name through an internal naming competition. The chairman and the co-founder proposed it kind of a little tongue-in-cheek. It was a tribute to one of his fellow co-founders, an older gentleman. He is 84 years old now. And he was at the origin of what they call the system's core microfluidic pumping technology idea. His name is Siegfried Strassler, and Sigi is his nickname. They said everybody liked it, also because, I love this, it evokes a certain friendly, reliable Swissness. And so it was voted. So that's why it's called Sigi. I love names. I just love to find out why these things are called what they are. I mean, sometimes it's just a number, like Omnipod 5 is the next one. Dash was number 4, and back from there, they're keeping it simple. I liked Horizon. I like with Control IQ. I hope that they keep names like that so we don't have to just remember numbers. It makes it easier, and it gives it a little bit more personality. So thanks for the definition of Sigi, and congratulations to Mr. Sigi, Siegfried Strassler. Although I guess if it's his nickname, I would not call him Mr. Sigi. I'm calling him Mr. Sigi anyway. We will keep you posted on how the Sigi system moves through the pipeline. And of course, I'm following closely on technology and hoping that we're getting more approvals and more movement for the US FDA for stuff that's already in front of them and that is in the pipeline. What's coming up? I will say that if you are interested in sending your child to diabetes camp, jump on that. Most of the camps have opened registration. They usually do that in mid-February or by mid-February. So chances are if you've got a local camp near you or you want to send your kid to a camp that's not local, go ahead, look that up. I remember when Benny was diagnosed, because camp is such a big part of our lives. As the kids got older, I was thinking, okay, we're going to do like a diabetes camp tour. I'm going to send him for a week to the local one. I'm going to send him to 3 weeks to that one because that goes for 3 weeks. I'll send him for 2 weeks to that one. Like I was just going to trek him around the country. But then, of course, he said no, he was going to go to the regular camp where his sister went. And that was the end of that. And I don't know if I've mentioned here before. I think I have. But he's going for 8 weeks this summer to be a CIT. I'm so excited about that. But 8 weeks, man. No share, no follow. They don't have Wi-Fi at this camp. He'll be fine. We're going to talk about how he wants to do it. I mean, he's 17 years old at this point. So I'm really excited for him. Okay, we have lots coming up. Please join me for In the News. We do that live on social media on Wednesdays, and then it becomes an audio-only podcast on Fridays. Thank you, as always, to my editor, John Buchanan from Audio Editing Solutions. Thank you so much for listening. I'm Stacey Sims. I'll see you back here soon. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.